Hey, I'm Jason Pozner from Boca Raton, Florida, here for the Plastic Surgery Channel with two of my good friends, Bruce Van Natta from Indianapolis, Indiana, and Ned Snyder from Austin, Texas. We have one story today that we're going to discuss, and it's back to BII again. So there was a video on TikTok by one of the influencers about how he's a believer in BII, and it brought this whole mess up to the surface again. So let's start with Bruce. And Bruce, why don't you talk about this and what you're feeling and where we're going with this, and then Ned.
Sure. So, I was a little surprised, honestly, at this from Tony, Anthony Yoon. He's been huge in social media. He does television. I mean, he is a real, really out there in terms of, as you point out, as an influencer. And yet, when you read that story, the story that was published in the New York Post, he says over and over that he believes the vast, and he uses the word vast majority of his patients are fine with implants. What struck me in reading through his comments was he doesn't cite any science. He's saying that it's real, but how the hell do you define real when we haven't even defined the entity? And again, not to say, and I think all of us, for the most part, would be in agreement, there is the possibility, which of a small percentage of patients that could have something going on related to their breast implant surgery. That doesn't mean it's the implants per se. I'm sponsoring some research that we're doing through the Aesthetic Society Research Foundation, and at Indiana University, Dr. Sinha has got some really exciting studies he's done looking at the effect of bacteria on fat, producing this immune modulator. And this is in the environment of the implant, but it's not coming from the implant. So this notion that you have to take the implants out, and people get suckered in because, let's face it, they've got symptoms, they're frustrated, they haven't found an answer, and they're desperate. And then they find somebody that tells them, okay, you've got breast implant illness, and the only treatment is this capsulectomy thing. And they're vulnerable, and I think that's unfortunate, and a lot of people getting surgery they don't need.
You brought up the science. I mean, one of the studies that's going on right now from our societies is with Microgen, who I did a lot of work on capsule contracture with. Right. And I was talking to Ned today on email about this, right? Which is, there is a study going on from ASERF about BII and sending the specimens to Microgen to look for bacteria, because that makes a lot of sense to me, that if you have an overwhelming contamination of bacteria, not a sepsis, a contamination, that could make you feel bad. Ned,
right.
Why don't you talk about
and
this?
That the breast is never a sterile environment. It is a clean, contaminated environment because of the breast ducts. Ned, what are your thoughts?
No, I can't agree with you more. I think at this point we can't say that some of these patients don't have something that's making them feel bad, and it happens after having breast implants placed. Only a percentage of them get better when we take implants out. Even out of this very small percentage of people that have, if we want to call it breast implant illness, that's not really a well-defined entity anyway. Even then, only a small percentage of them get better. But the fact that some of them get better, you can't explain it all by placebo. So there's something going on, but I think it's more likely to be something, as you said, bacteria that's been that's slow growing and been relatively dormant within that capsule. And we have some data supporting that now. We need a lot more, but
I mean, far and away, the number one patient I've seen, and I don't have a huge BII practice, the number one patient I've seen who wanted their implants out are someone who's had their implants in for 20 years when they were 30-something. Now they're 50-something. I'm getting night sweats, and I gain weight, and it's my implants. And okay, obviously to me that's someone going through menopause and has nothing to do with the damn implants. And you take the implants out and they still go through menopause.
Right.
And I don't want to make fun of BII or anything, but that is a percentage of the patients that are coming to us having read all this stuff on the internet. I think we need to dissect it down and get rid of these various groups and find out the patients who really did get better, why did they get better, and try to figure out what is really going on. And that's what our society is doing. They're not putting on videos on TikTok. They're actually doing good hard science to try to figure this out. And you know what, Bruce, you're a little older than me, not much, and Ned's certainly younger than both of us. But didn't we live through this in the early 1990s with the breast implant crisis? Talk about that.
Absolutely, Jason, and it's a little bit of deja vu all over again. And the big difference, though, we didn't have social media. Yeah. I mean, this is taking in my view, taking what we went through in the 90s and all these allegations of all these problems related to breast implants, and you're throwing gas on the fire. And unfortunately, people get to this, they don't have the ability to filter. And some of these groups, it's kind of like the anti-vaxxers. It's a bit of a cult, it's groupthink, and you're either all in or they shame you. You know, somebody comes back to this Facebook group and says, well, I had my implants taken out and I still have my symptoms. And they're like, well, you haven't waited long enough, you didn't go to the right surgeon. You know, rather than ever acknowledging I mean, even if you truly believed in the whole concept of BII the way some of these people do, it can't be all these people. Right.
There's no way that it's all these people. And I think that we all agree on that.
And there are millions of women out there, millions and millions of women with breast implants, right, who are happy with their breast implants or are non-symptomatic. So this is a small percentage of women that seem to be having problems. We are doing our best as a society. Of course, Bill Adams is the president of ASAPS right now, trying to figure out why this happened, just like we did in the early 1990s when we thought that breast implants caused autoimmune diseases, right? That was the whole thing, autoimmune. And it turned out that there were a lot of young women with or without breast implants that got autoimmune diseases. And listen, there's nothing that we would like more than to figure out why this is causing some problems in women so we could address these problems.
Well, yeah, and I agree that research is so important, but that can't happen overnight. But it's, you know, it's not like we're blowing this off and discrediting it. But what most of us are asking for is good science. Good science takes a while. You know, we're working on it, as you pointed out. Bill's study on this, and we've got the other one that I mentioned that we're doing. I mean, there's a lot of good work that is happening, but it's going to take a year or two to sort out. And I'm not sure that Tony helped the situation.
I think he added fuel. I think Tony added fuel to the fire with this.
I agree. I was disappointed.
No, well, totally. I think that you can't just make comments that have, if you're out there as some sort of authority, even if it's your social media authority, but you've got followers like he does, and you make comments about things that those comments have meaning, at least to a certain percentage of your followers, that that you kind of have to be careful about what that conveys.
I mean, if he got up on stage at one of our meetings and presented this as a scientific talk, he would be laughed at, no question.
Well, there was no science in the talk, right? I mean, he's just making comments, but it has to have some scientific backing to have real meaning.
Gentlemen, thank you so much for getting on. I'm Jason Pozner. I'm here with Bruce Van Natta and Ned Snyder. And for more information, please go to theplasticsurgerychannel.com or go on YouTube and look at the Plastic Surgery Channel on our YouTube channel. Thank you, guys.